Carolyn. Welcome to the Treatment Room Secrets podcast.
Oh, thank you for having me.
Very fun. We've spent a couple of days together now. Can you help me pronounce your last name?
Greenhalgh. Greenhalgh. A lot of people say greenhouse or greenhalgh, but it's Greenhalgh.
That would have been me, that thing you just said would have been me. So Greenhalgh.
Yes, like the bakers, but you wouldn't know that because you're from Israel.
Is that a local bakery?
It's a huge bakers, but unfortunately I don't belong to that empire.
So we're here in Macclesfield. I know technically Stockport, Stocky, from what we've been told. But Macclesfield's, I did not know this, so I feel kind of ignorant, but very much integrated and a main part of the Silk Road.
Yes, the silk trade.
The silk trade.
Yeah.
And everything in Macclesfield, you mentioned, is silk this, silk that, Silk Road.
Silk Road, Silk FM, yeah. Everything is related to the silk trade along the canals, yeah.
And it's fun. I told you I've been to Macclesfield before. Many years ago, I watched Macclesfield play League One football. Wayne Rooney's brother was on the team, so that's my memory of Macclesfield until being here now, here with you. And we filmed a course together, a complex course, no pun intended, about the complex shoulder, and just something very interesting because even you just explaining certain things, pointing out things, using me as a model for the camera. You pointed out some deficiencies in my body, things that I maybe assumed that I did not have those imbalances or did not have those, would you classify them as pathologies? Don't scare me.
No, I don't, I don't like labels, but I think maybe an imbalance would be more appropriate. Yeah, you could work on something to stop deterioration of that instability, or instability causing you a further problem, which would lead to pain, because you don't have pain, but we notice some excessive movement.
Don't I have pain? Like after I said that, I started thinking about it. Now I'm maybe imagining pain, but could I just be used to a small nagging pain on my shoulder?
Well, yeah, you just said so. So yeah, possibly, and but not. It's not been bad enough for you to seek help, perhaps.
Why don't you like classifying labels?
Because training as an osteopath, historically osteopaths weren't part of the medical model, doctors and physios and so on. They had their own theories and their own training. They didn't belong to the medical model, so osteopaths have always treated what they found, which is a set of symptoms, but never thought to put names to it. They treat what they find. But when osteopaths had to join the medical model in 1993 or 1999, something like that, if we wanted degree status and to be recognised within the medical profession, we had to join the medical model. And that's when we started talking about labelling things. But historically, you could go to an osteopath and they would treat you for high blood pressure or a disease. And osteopaths, that's what they used to do. But we couldn't join the medical model and say we could do that. So people who wanted to get a qualification that was recognised, we had to jump through the hoops and join the medical model, bend a little bit in order to get our registration and stature that way.
Is it, in your opinion, does it limit the osteopath in any way? Having to bend a little bit and label certain things, or I'll broaden the question: does labeling symptoms?
Labelling symptoms limits, yes, because that would suggest once you have a thing, then there must be a step-by-step, dot-to-dot way of dealing with it or treating it. And as we all know, that no two human beings are the same. So there isn't a dot-to-dot how to treat that particular thing with the name. So It's funny. I was listening to a lady who's a physio. She's a specialist physio, and she was talking about the shoulder, and she was talking about how nowadays physios are coming full circle towards osteopathic thinking and coming away from labelling, whereas we've never wanted to join the medical model because of the labelling, and now it seems to be coming full circle where they're moving away from you have a tendonitis, you have a, rather than saying there's some problems with the tissues, these tissues are more likely to be involved, so therefore you're not scaring a patient or labelling and making a patient think, oh, what do I need to do for that? Do I need an operation? Do I need an injection for that label?
Label specific thing.
Yeah.
Is it a labeling something? Does it maybe provide some psychological comfort in a way? Because look, if we look at the body holistically, because that's what you're saying pretty much, right? To see the whole human body as one organism, and if you have a symptom in your knee, it could be affected by something else in your body, which could be affected by something else in your body. It seems like way more complicated to solve the root problem, or to even figure out what the root problem is, than to label something. Maybe I'm providing my patient with some psychological comfort because me as the expert, I now know what you have. We'll put you on a program to solve this. Again, it seems like to me, even if the answer is yes to my proposed question, it's probably short-term psychological relief.
Yeah, I think if somebody is going to visit somebody, a professional who's only got 5 minutes or 10 minutes, then a label is, you want to come away thinking, what's the answer to my problem? What's wrong with me? And within 4 or 5 minutes, you might be able to say, yes, you have anterior knee pain, but within 5 minutes, you haven't got the time to ask the questions about the person's genetics, their work situation, their hobbies, and what might have brought additional factors giving them the anterior knee pain. And that would, obviously allow you to get to the root of the problem. But I think within the UK and the NHS, the people are stretched, and some people's contracts don't even allow you to touch them at the moment. I think there's less time to be able to get to the root of the problem, unless somebody is able to give somebody time. In private practice, I've got an hour or 45 minutes I can listen. Whereas if you go and see a GP, or if you have an NHS physio appointment, in some areas they only have a limited amount of time. But the NHS physio way of dealing with things and their training is to label something, and then they have a regime or a step-by-step how to deal with it. But as osteopaths, we're looking for the root cause.
Also, in my personal experiences with some maybe like health complications, seeing doctors from different countries around the world, it's very quick. It's, hey, you have this, probably because of this, and here's your medication. Come see me in however many weeks, months for a follow-up. I guess no one has the time, or they think they don't have the time to really investigate and learn about maybe the root, where this thing is stemming from. But I'm also looking from the patient side, the client side. I think most of us probably do want a definitive answer, even if it's not 100% accurate, and most of us probably do want a medication, because we know that being on a medication for 3 weeks is a lot easier than being on a 6-month rehab program.
Yeah, everyone wants a quick fix, right? Everybody wants somebody else to fix their problem, and I think that's where the problem lies. Your knee pain at the age of 52 is because you've lived for 52 years doing what you've done, or with your particular genetics or the hobbies that you've had. But if going to a doctor or going to another professional and saying, "Here's my knee, can you fix it?" It's not it's going to work that well if you're not going to take responsibility for your own body, what's brought you there, the factors that might have brought you that knee pain over the 52 years. But yeah, it's easier to say, I have this problem with my knee, you fix it. Whereas we like to engage our patients and give them a diagnosis to start with and help them understand the diagnosis and what might have brought their pain to them in the first place. And if there's factors playing a part, like the way they're sitting at work or a repetitive thing that they're doing, maybe there's some treatment or maybe some rehab that could help counteract that. So we try and get people engaged functionally to help them.
I heard you say that your journey of becoming an osteopath started when you were 7.
Yeah.
Can you take me down that road?
Yeah, what a strange road. So yeah, we lived in Stockport, working class family.
Oh, so you lived in Stockport?
Yeah,
Oh.
I lived in Bredbury, and when I was in Bredbury, I did ballet from a young age, and we moved to Marple, and I was doing ballet 3 or 4 times a week. I was pretty good at it, and I was playing one day. I was playing one day with my friends on the scooter, and I was trying to keep up with my friends, and I took a wrong turn and they were going in a different direction and I didn't want to get left behind, so I fell off the pavement, fell off my scooter, and I broke my leg. So I broke my leg and I had a plaster of Paris cast from my ankle all the way up to the groin, which was really weird because the break was down here. I don't know why they did a plaster of Paris cast all the way up here. But they didn't give me crutches.
All the way up to your hip?
Up to my groin, yeah. And I remember a conversation in the hospital, where they said something about either not being old enough for crutches or they didn't have crutches. But they gave me this boot, and it was like an orthopedic boot, and it was that high. So I had this big plaster of Paris cast on my leg, this orthopedic boot. So I was walking around like that.
As a 7-year-old.
As a 7-year-old. My mum caught me on the back step trying to put when you used to unscrew roller skate, you're too young, unscrew the roller skates and lengthen them, trying to get my roller skates on this orthopedic boot at the bottom. So I was still trying to get by. And of course my ballet teacher insisted that I still went to ballet to watch, even though I couldn't do anything. The plaster of Paris cast came off, the bone had healed absolutely fine, but I went abroad with my family and on a holiday. And I started walking on my tiptoes on one side. So they thought I'd sprain my ankle. Typical, she's hurt her ankle. So I'll just put a tubey grip on it. And that was that. It didn't make any difference. I was still walking around on tiptoes on one side. And it was only when we got back to the UK and I started going back to ballet, my ballet teacher said to me, there's nothing wrong with your ankle. It's your back. You want to go and see my man, she said. You want to go and see my man, Madge Watson. She wore bloomers and everything. She was so old-fashioned. You want to go and see my man, Dr. Johnson. It's got nothing to do with your ankle. You're not walking on your tiptoes because of your ankle. There's something wrong with your back. So I went. We didn't even know what an osteopath was then. It was the first time we'd ever heard the word. Me and my mum drove there, and this man had this very strange room with little bottles and jars of lotions and potions in, and he sat me on this gym horse, like an old-fashioned gym horse, and manipulated my back, and I walked out of there with both feet flat on the floor. So that was my introduction. He was an osteopath and he was a naturopath as well, so he did natural medicine and herbs and nutrition and all that kind of stuff.
Very interesting. And did you stick with him?
I stuck with him until he wasn't around anymore, and then I had to find somebody a little bit closer. I must have seen about 10 different osteopaths. Some used to come to the house, and I used to drive various different places to go and see different osteopaths because I kept having to have the manipulation because I was growing, and my back had adapted around this pattern. It had been like that for 6 weeks. So I'd got this altered leg length and my back was all skew-whiffed, and occasionally it would give me a problem, so I'd have to find the osteopath. So I was constantly going to the osteopath, or not constantly, but regularly seeing an
But
osteopath.
mainly because you were trying to dance and be compete, or was it competing in ballet? Was it performing in ballet?
Yeah, I wanted to be a prima ballerina, and
Yeah.
there was a point in my childhood where the decision was, do I go to a normal school or do I go to full-time ballet school? So yeah, I always had to be as flexible as possible, but also as strong as possible. So I had regular osteopathic treatment.
And is there anything that from his natural therapies that he was doing that stuck with you, that you enjoyed, that freaked you out? Anything that you remember?
I can't really remember. I just remember this gym horse. Yeah, I can't remember anything else.
Yeah. So you believe that stemmed your interest?
It must have done. When I was 11 at school, as part of our English exams, we had to do a talk in front of the class, and some of my friends were doing it about makeup. A talk, like a 2-minute talk on makeup or spots or boys or something like that. I did my talk on osteopathy from the leaflet that he gave my mum. I mean, I must have sounded a bit like one of those crazy children.
So for those that don't know, because even me, I would say until a few years ago, until I visited my first osteopath, I did not know what an osteopath was. So what is an osteopath?
Wow. Well, we help people with pain or dysfunction. I was saying earlier that we used to treat any kind of problem with health or dis-ease, the word dis-ease or disease. So we look at the body, the anatomy and the physiology, and the theory behind osteopathy is that all fluids have to flow well to your tissues, otherwise that would lead to congestion and disease in that area where there was a backup of pressure and congestion.
Is that mainly blood when you say liquids?
So in osteopathy there's a rule of the artery. So wherever the blood flows, the blood must flow easily and well, and if it doesn't, then whatever tissue that blood supply is going to have a problem. It's going to have dis-ease. But it does apply to the other internal plumbings of the body as well, not just the blood flow, so nerve flow as well.
So nerve and blood flow. And then what certain techniques are there to re-engage the circulation of blood flow to certain areas?
Yeah, so osteopaths use manipulation of not just of spinal joints, but all of the joints to help reset the tone of blood vessels, because blood vessels contract and relax, and sometimes if they contract, then blood isn't going to flow well, which would lead to a problem with the tissues. So using manipulation of the joint can sometimes help cause a blood vessel to go back to its normal state, so blood can flow well.
Yeah, super interesting things to really think about. And also when you're, again, because I know you very briefly gave me some demonstrations today on certain things, and from the patient side, it feels intuitive. Like it feels that those movements should be happening, that pressure should be felt, and that your body it feels like your body appreciates it. It does. That's what it really feels like. So you're a 7-year-old girl. You're a dancer. You keep going back to osteopaths. You need this care, this manipulation sometimes, whatever's done on you to keep you going and feel good. But at what point do you decide this is a career or something you're going to pursue forever?
Well, the ballet career was ended because I wasn't naturally turned out enough. They said I had beautiful arms, but something had gone wrong with my legs. So that destroyed me and my confidence.
How old were you then?
I think I was 12 or 13. It was that choice of going full on down the ballet route or not. So I rebelled.
Is that weird thinking about though? Like as a 12-year-old, do you even have to go through that judgment?
I was devastated, absolutely devastated, and I think it stuck with me as well. I mean, and they say you shouldn't say things in front of in front of kids, but I'll never forget her saying to me, "There's something wrong with your legs." So I've always been really conscious of my legs. I mean, there's nothing wrong with my legs, but it did stick. But I rebelled against that, and I went into a different kind of dancing. So I did modern jazz dancing, and absolutely loved that. Well, I rebelled against that right then. I mean, I was built up that, I was going to be an amazing dancer or whatever. And
by then?
Everyone.
So also in your family, like
Yeah.
everyone spoke of you
Yeah.
as a ballet dancer, and that's what you're going to be.
That's what I was going to be. There was just no question of it whatsoever. So yeah, I rebelled. I did modern jazz, I did panto, and carried on dancing. But so it was always about movement and, keeping fit, and it was just in me. And I did my studies and left college, went travelling. When I came back from travelling, I was quite overweight. So when I came back overweight, I decided that I was going to become a fitness instructor to lose the weight, purposely to lose the weight. So I trained to be a fitness instructor.
But why? Because in your logic, you to be a fitness instructor, you need to be in shape?
Well, it was one way of working and yeah.
Two birds.
Yeah, absolutely. So I trained to be a fitness instructor, and I absolutely loved that. But I was still having osteopathy regularly for my back problems, and it was suggested to me that maybe I wanted to go into osteopathy. No, in fact, I'm telling a fib there. I thought I might fancy going to train to become a physio, because I was seeing an osteopath. I loved exercise instruction, and I thought the natural progression would be to become a physio, because that's what everyone did. And here in Stockport and Manchester, we've got the marvellous Salford University, where they train loads of physios. So I thought, I'm going to be a physio. And my osteopath at the time said to me, "You've never had physio in your life. Why would you want to train as a physio? Why don't you train to become an osteopath?" So I was a bit torn, because physio was mainstream and everyone did physio, and osteopathy was a little bit out there and a little bit rebellious, a little bit fringe. So I started to become uncertain. So I thought, I'll test the water. I'll do a massage course first, see if I like it. So I was working at a gym, and I asked the guy that I was working for if I could have some time off to train to be a massage therapist. I'd need some weekends off working from the gym, because I wanted to study massage, and he said no. So I left that. I trained as a remedial massage therapist, absolutely loved it, and then thought the natural progression then would be osteopathy.
So you left fitness instructing just because that guy was not very helpful?
He wasn't helping me develop my career, so I left.
But did you enjoy it?
Yeah.
And when you worked in a gym, one-on-one with people, or was it classes?
I did both.
Yeah, and you enjoyed.
Yeah, I loved it.
And did you get fitter, stronger? Did you?
Yeah, it was just in me to move. And I loved anything to do with the body, and I've always been that kind of person that I just want to help other people. So yeah, I loved it.
So, osteopathy.
Yeah, I did 3 years training at Oxford Brookes University, and came out with a degree from there. And I worked with another osteopath for quite some time, and then I branched out on my own. I went working, did some charity work in Sarajevo with some other osteopaths whilst I was still training. I had a couple of issues myself with my shoulder that hindered me a little bit at the beginning, but...
Was that helpful to you though, like experiencing different injuries, problems with your back, the leg?
It must have been, right? Thinking about it, that's it, isn't it? It's what happened to me, I think. Subconsciously, I didn't, it must have been because of what had happened to my back, and then what happened with my my shoulder as well obviously led me towards having the passion for the shoulder joint.
Yeah.
Yeah.
And Sarajevo.
Sarajevo, yeah.
So what? Yeah. Can you tell me a bit about that experience?
So I was training to be an osteopath, and my mentor, Liz Ellis, the wonderful Liz Ellis, was going to be doing some charity work with another osteopath who was teaching us. And unfortunately, this osteopath's mum died and dad died very, very close together. And the charity wouldn't allow him to go because of his emotional state. And this trip was happening, in the next couple of weeks or something like that. So my mentor, Liz, said to me, would you like to go in replace of him? So I said, yeah, of course. So we went out to Sarajevo just following the war, the Bosnia-Serbian war, just as things were starting to get back to normal. There were people still stuck in high-rise places. There were still people hiding in basements and whatnot.
So was this early 90s?
Mm-hmm. And we went to support. I thought we were just going to treat anybody and everybody, but what I realised after being there was that we were supporting all the physios and all the manual therapists who had been working and working and working with no break, and we were there to give them a bit of respite. So yeah, we did two weeks charity work, helping anybody and everybody who needed some help with something.
Was it intense?
Yeah.
Are you glad you went?
Yeah, of course. Yeah, it was an amazing experience. So it felt wrong to come back and say it was an amazing experience, because it's quite harrowing to hear all the stories. But yeah, life changing. Yeah.
Was it scary?
No.
And were you stayed put in Sarajevo?
Only for that short period of time.
Yeah.
Yeah. It was good. We were guided wherever we went. We were with guides. Yeah.
And what, just anyone who had any medical background pretty much was full-time working to help people manage their trauma?
This was with a charity called the Healing Hands Charity. I don't even know if they're still going. But yeah, they wanted to help anybody hands-on from whatever background. So there were people doing Reiki and other body workers, but Liz and I were I wasn't qualified as an osteopath then, but we were doing osteopathy or remedial massage therapy to help anybody who was queuing up, wanting some help.
So this was when you're getting trained, like still in university?
Yeah.
So still in university. And then when you finished university, you started work. You mentioned you worked with another osteopath.
Yeah, I worked with somebody else, and then I branched off on my own. And worked within a multidisciplinary clinic. So I was really, really fortunate. During my training, we had to have lots and lots of mentored hours. So I worked with different osteopaths who approach things in very different ways. So I do feel very honoured to have experienced Liz Ellis and Brian Walker and all these other people who came at osteopathy and treating their patients in slightly different ways. So when it was my time to go off on my own, I could do it in my own way as well. Yeah.
And now, do you feel like you've cultivated your way?
I think so. Yeah, I think I have. I mean, there's always I'm always learning. I'm 52. I've been doing osteopathy for 22 years, but I'm always learning. But I seem to be going in one or two particular directions, and my patients love it. So
which are?
Well, I like to empower my patients once we have their problems sort of solved, or if they're on their way to recovery. I like to engage them into making sure that problems don't happen again. So the exercise and rehabilitation has come back in there, but I do have a huge passion for the shoulder joint, maybe because of my experience, maybe because of other osteopathic training that I've done. But yeah.
And because I'm assuming over the years you've helped a lot of shoulders. Is there anything there that, I'm assuming it's a satisfying feeling to be able to send someone home happier or in less pain than when they showed up to your clinic?
Yeah, I think that's what keeps osteopaths being doing what you do, it is the satisfaction of being able to help, for sure. And allowing somebody, I mean, my strap line is to help people be able to move so they can enjoy and live the life they love, whether it's, you know, an old lady who just wants to be able to do her gardening, or the, you know, professional athletes that I have as well who want to excel.
On the way here, I was, maybe blabbing on about knees. Can I ask you about knees? Because now that I remember that, I just remember that on the way here, I was talking to you about knees, but I heard you say a few hours before that you don't like knees.
I don't enjoy knees. Knees are complicated. They're complicated. I mean, the shoulder joint is probably more complicated than a knee.
That's what everyone says, right?
Yeah, but knees are load bearing, so they're quite tough to rehabilitate unless you've got somebody who's really fully engaged. In my opinion, yeah. I don't know what it is.
So what about, like, if someone came in with a knee injury, like, you know the level of engagement it takes, so that you know it's going to be a tougher process, maybe?
Well, I know all the tests to do. I know how to examine a knee, and I know what problems can go wrong with it. But I don't get the same satisfaction. I can't put that. I don't know why, but I don't get the same satisfaction out of rehabilitating knees as I do with the shoulder.
What is the most maybe unconventional thing that you like to implement in your practice?
Unconventional?
Or maybe that you've developed yourself, or that you've learned somewhere and have tried to implement it and not necessarily learnt about it in university, being trained as an osteopath.
So it's quite sad, really, but we were talking about the healthcare system here in the UK. You know, everyone working in the healthcare system does an amazing job. Individuals are doing amazing jobs. The system is perhaps is failing people with waiting times. So problems that they have that may be acute to begin with are turning into chronic problems, and then people are having to adapt around that. So it's quite sad. But a lot of departments within the NHS, they don't talk to each other. So you go to this department for your eyes, this is the hip man, this is the heart man. You could have 2 or 3 problems going on. They may be related, but nobody seems to put the puzzle together. And that may be because of the way the system works. People haven't got the time to spend to put those pieces together, like the GPs back in the old days used to spend time. They haven't got that time. You have 5 minutes and you're allowed to talk about one problem here.
Is it actually 5 minutes?
You get 5 minutes and you have to talk about one problem. So
you can't bring up on paper 2 problems.
That's another appointment. That's right, isn't it? Am I allowed to say this? Anyway,
yeah.
So the problem occurs because the person isn't just a knee problem, or the person isn't just, I have a pain in my shoulder. There can be other things going on, and I find it really sad, but this is my superpower, if you like. I feel privileged to have had osteopathic training. I see a lot of people who have been to the doctor, then they're waiting for something, then they're sent somewhere, and then they find something out, but the other person hasn't read that they've also got something else, and they end up coming to see me way down the line, often not a last resort, but it's way down the line, and I feel like I have the detective skills. That's my superpower, and I put all the pieces together. A lot of the time I'm referring back into the NHS saying, listen, this person's in the wrong place, they need this or they need that. But I do feel very privileged that I'm really good at going through all the body systems, not just they have a problem with their rib or their knee. I'm trained to look at all the body systems and perhaps put all those pieces of the jigsaw together and say, actually, this man needs this.
There's some criticism that osteopathy receives. Do you entertain any of it?
No, I think the criticism comes from somebody who's not seen an osteopath. I see GPs My friends are orthopedic surgeons and so on. I think if you haven't been through the process of how we take a history and how we examine, and the level of detail that we look into before we treat a patient, I think if you haven't been through that process, then I think they think that we just crack the back and that might be dangerous. But they don't realise that we're trained when not to do it, as well as how to do it very well. And osteopathy isn't just about the crack. It's about all those other factors. It's the history taking. It's the listening. It's examining, and using other techniques, not just manipulation. We use massage and stretching and mobilising, and then of course the rehab. But I think a lot of other professionals who have never had osteopathy will think that we just crack backs and that could be dangerous.
When you say cracking backs, my head goes to chiropractors, especially as if you saw my social media feed, you would just see cracking backs after cracking backs after cracking necks. And as of recently, also animal chiropractors. I don't know if you've seen those, which are very entertaining to watch. So is there a similarity though between chiropractors and osteopaths, and if yes, what is it, and what separates the two professions?
It's one of the most common questions that we get asked once somebody comes to see us and they're comfortable and they're happy with the treatment and stuff is, what's the difference? I wasn't sure whether I was in the right place or not. Should I have gone to a chiropractor? And actually we're both trying to do the same thing. We're both trying to help people with pain and stiffness or restriction in movement. But the founders of osteopathy and chiropractic, they actually knew each other. And whereas I said before, osteopaths used to still think of the problems with the body as a problem with things flowing through the body, the internal plumbing, blood flow, lymph flow, nerve flow, and looking at the spine to change that. Chiropractors believed, or their theory was, that all disease or all problems came from dislocation of the spine. So it's slightly different. This was just spine, and it was like a dislocation or a subluxation of the spine. And they used to diagnose problems using x-rays. Chiropractors, until here in the UK, there was a radiation risk with that. So now they use heat scans. Osteopaths, we examine people during movement, so we'll ask you to bend forwards, bend backwards, move your arms and things like that. Chiropractors used to x-ray, and now they use heat scans to look for areas of tension or inflammation. And the treatment, it depends where you go. I think a lot of people will think that chiropractors just do cracking, and a lot of chiropractors do just do the cracking and the manipulation. And other people will think, osteopathy is a little bit softer, or they do a bit of massage and stretching first, which I would say is most osteopaths. But there are other chiropractors that will do soft tissue work and stretching, so it does depend on who you see. But the outcome, we all want the same outcome: less pain, more movement, happy patients.
In the US, at least from my reading, is that chiropractors also don't give much time. It's very quick, 10-15 minute appointments. So maybe did chiropractic medicine also start as in looking at the body as an holistic organism and trying to find the root cause of things?
Yeah, the reason for manipulation of the spine is that they want to change the nerve flow to a tissue. So the nerve from the spine is going to affect the blood flow, which is going to affect that tissue that it serves. So it's very, very similar.
And in osteopathy, then, you're saying something similar, but not necessarily stemming from the spine.
Correct, yeah.
Have you been to a chiropractor before?
Well, you were talking about America, giving five
Yes.
minutes. So
just no time for them to ask the questions, to really find out the history and to understand the person, the human body they're dealing with. And again, I'm sure it's not all chiropractors, and I'm sure there's amazing ones. But that's what a lot of feedback that I hear. You want to make an appointment for a chiropractor? Great, you have 15 minutes. And forget about the money that goes behind it. And of course, like, pain, we want to solve pain, but maybe there's better ways to solve pain. Like you were just saying that, you see someone in the NHS because everything is so separated and people are looked at not as a human, but you're coming to me for your hip and then you go to him for your knee. I don't really care about your knee. You go to him for your neck. So it's so separated that you miss things.
Yes.
As a result, you have to miss bits.
Health.
Yeah, you miss important pieces, and again, I guess you can classify this as negligence. But even me recently, I spoke to a family friend who, for months and months, was doing rehab to his back with a physio because he had back pain. And only after months and months, he went for an MRI, and they found a tumor. Trying to expand into his spine, and that's what was causing this terrible back pain. But he's there doing exercises and stretches for his back to try and recover from this tumor. He's okay now.
That's good.
So all good. But so it's just to me it seems intuitive to look at the human body as one organism, and if something goes wrong, or it doesn't have to be something goes wrong, but if you're causing harm to one part of your own body, because I also do believe that a lot of people cause harm to themselves. It doesn't, not always, it just occurs out of nowhere. We make choices and it can affect a certain part of your body. Let's say smokers, maybe they have some horrible condition that's not lung cancer, that's not coughing, that's caused by the smoking.
Absolutely.
But they,
the shoulder, the tendons, they degenerate much faster.
There you go. So, but a smoker wouldn't put 2 and 2.
No.
So it's very difficult. And I'm assuming from your perspective too. And do you think that has developed in you over time even more? Because you're speaking to me about still now you're focusing on movement, nutrition. You said is an interest to you.
I think the osteopathic training about looking at people as a whole is there. That's never going to go away. And I pride myself. I mean, you were talking about chiropractors giving people 15 minutes, and you may be talking about chiropractors in the States. I think some osteopaths and some chiropractors here in the UK may do the short treatments as well, and things may be getting missed, but I pride myself on giving people time because I'm nervous that I miss something. So I may not see as many people in one day as somebody else down the road, but I pride myself on allowing that person time. Like we said earlier when we were filming, it's not about asking the questions, it's about listening. I probably digressed a little bit there.
That's good. No, but the nutrition part. So I mean, like, is it? Have you always been interested in nutrition and the effects of nutrition? Again, looking at the human body, we're stuffing things down our mouth, throats, and a lot of people, we want to believe that it doesn't affect our body as much as it probably does.
Absolutely. When I went into osteopathy, I was socialising with osteopaths even when I was a massage therapist, and I was going on nutritional courses internationally with other osteopaths before I was an osteopath, and I was only young. I was like 26, something like that. I've always attended lectures and seminars and webinars about nutrition because I think food is medicine. That's how I see it. Maybe back in the day they'd have probably killed me for being a witch, but I think food is medicine and plant is medicine. We have everything we need on this planet, but I think the modern lifestyle is probably playing a bad part.
I like looking at food as medicine, but I can also see that as potentially being dangerous in a way, just because I think it's way more than that, because it's not just can be like looking at it as medicine, as positive, but it's can cause harm, food, right?
Yes.
It can really do damage to you based on your choices, which again, because I think people that maybe only stuff bad things down their mouths maybe would also agree that food is medicine, but won't necessarily agree that it can cause them damage, literal damage by eating the wrong things.
Yeah, it comes down to education. I mean, for years everyone has known that sugar is not great, but the world we live in still puts it at the checkout.
It all started here in England, no? Sugar.
Sugar. No, America. It's got to be.
Yeah.
Was it? I don't know.
Someone has to fact check us.
Yeah,
I
definitely.
have a feeling someone told me a story, or I read a story about just the sheer number of the sheer amount of sugar that was being transported to the UK. In the time of the Great Empire.
Okay.
And people here were lavishing on sugar.
Yeah, and we know how addictive it is, right, for the brain and the body and the hormones and everything. Yeah, but I think in the UK, everyone knows it, but it's like smoking. When you're smoking, you're not dying of lung cancer. When you're shoveling sugar and maybe fats and things, it's great, and it's not killing you right there and then on the spot, is it? So it's that other killer, isn't it? Sugar.
Yeah, a slow killer. But also that. But what it does do. Okay, so I think we also kind of spoke about this before. It might not kill you at that moment, but it's completely taken over your mind.
Oh.
If you see a piece of cake, like you're not thinking about anything else besides that piece of cake.
It's there.
If it's there, exactly. Very difficult. But I know you're not a nutritionist. But do you speak with your clients about nutrition?
Yeah, I feel very, very privileged. Like I said earlier, and am I allowed to name companies or not name companies? I don't have to.
Yeah, absolutely. Yeah.
But years ago when I was training, I got involved with a company called Nutri. They were called Nutri West. They're now Nutri Advanced. They're still going. A family-run nutritional business. But I used to go to all their seminars. And yes, as an osteopath, although I'm not trained as a nutritionist, I have the knowledge because I attend all these wonderful webinars and seminars. But they're great because they have a nutritional team on the phone. So I've always been very fortunate to be able to ring up and say, hey, I have this 55-year-old lady. She's reached menopause, she's struggling with her joints and she's looking at supplementation. She's suffering with this. She takes this medication. How can I help support her joints? And they will come back to me, and I'm insured, I'm safe. And it's the same with the Modair company. We've got clinical nutritionists and scientific backing. I feel privileged that we've got people to ask. So I'm not qualified as a nutritionist, but I think it's important for people to know that, yes, I can help them. I can help you with your shoulder. I can help you with your knees. But when you leave here, what are you going to do? Are you going to keep repeating that behaviour? Are you going to keep sitting like that? Are you going to keep standing like that? Are you going to keep shoveling stuff into you that's going to create inflammation in your joints? Are you going to keep shoveling things in you that's going to increase your weight? Or, have you looked at perhaps your joint pain maybe because you're reaching menopause, blah, blah, blah. So, yeah, I feel privileged that I can support them with their healthy living.
Do you also engage with maybe other elements besides nutrition with your clients, or referring to other professions, or getting advice maybe from other professions to help you with a specific treatment or a specific patient?
Yeah, all the time. I think that's key, and we spoke about that on the course. To work in isolation as an osteopath or a manual therapist or whatever, to work in isolation, if you're not asking questions, if you're not discussing cases, if you're not attending seminars or webinars or collaborating, I think that could be quite dangerous because obviously things change with time. But also, people want to help, and two heads are better than one sometimes. But yeah, I'm frequently I'm collaborating with personal trainers. I'm always referring people back to their GP with letters about maybe some investigations that we want. I've got orthopedic surgeons who I can talk to and say, hey, listen, I know you're the shoulder guy, but who's the hip guy? Or I've got this person, I'm not sure, I've been trying this for 3 or 4 weeks, we're not getting any progress, is it time to refer to you?
So do you have that community of professionals around you that you kind of engage with, that built over time?
Yeah, acupuncturists, body workers, people who are doing...
And is that something that you consciously did, or it just kind of developed over time?
No, I think it just develops over time.
But is it something that you would advise maybe young professionals, whatever they are trained at, to work on developing?
Definitely collaborating and saying, hey, I'm working with somebody who's got this shoulder problem, but they've got some pins and needles in their arm. There's nothing wrong with the neck, but I know that acupuncture has been able to help such a body with pins and needles. I'm going to send them to you, but I'm working manually on their body and doing some rehab with the shoulder. Maybe you could help them with the pins and needles, that kind of thing, or maybe for pain. But yeah, I think it's really, really good to ask for help, but not help that I can't do anything, just to collaborate and say, I'm working with this person, what do you do?
Do you have clients that come in, patients who do want a quick 10-minute manipulation and get me out of it, who do not want to tell you about their history, who do not want to tell you anything?
Yeah.
They do not want to tell them to stop smoking or stop eating sugar?
Yep. Absolutely. As you can tell, I can talk. I can talk and I can talk and talk and talk. And I like explaining. I like being transparent. I like people understanding. I think it's important that they understand what their problem is. Some people, no, they don't want to know because they're clock watching. They've got to go back to work. They don't want to know what their problem is. I'm here. You fix it. There's your money. And off they go. They don't want to take responsibility. I apparently am the fixer. It never works. It doesn't work. And usually those people will go to the people who give them 15 minutes. But that's not how I work. And I'm not saying my way is better. It's just I just want to make sure that I've listened to everything. I haven't missed anything. So I like to give people time. And I do think in 15 minutes, how could you possibly listen to, is there anything wrong with your heart? Is there anything wrong with your digestive system? And, what about those previous injuries that you had in 1999 or whatever?
How has your clientele changed over the last 2 decades in terms of maybe demographic or types of injuries, pathologies that you are faced with?
I think the demographic is pretty much the same, maybe slightly more active, sporting, younger people coming through, because I think with COVID as well, I was putting myself out there as, here I can help you exercise. Whilst we couldn't treat people initially, we were talking about exercise and rehab. So I do get a lot more people coming in who are gym buddies and sports professionals and things like that. But I still see, the elderly, I still see teenagers and younger children as well. So it's a real wide variety. But I think, when you find a good car mechanic, you stick with them because you trust them. I have a lot of patients who have been to see me for many years, not like they're still coming with the same problem, because that would be wrong, but they know how I work, they trust me, and if they have a problem with maybe another area of the body, they come back. And word of mouth, so the whole thing works on word of mouth.
And in terms of injuries, pathologies that you face?
Wow, more and more now. It's the tech neck or text neck. It's the desk worker. We're all working from home in the rat race, so the head's gone forward. We were laughing yesterday.
The shoulders too, right?
The shoulders are forwards, and the young kids, it looks like they've got no heads because their head is that far down looking into their phone. It looks like they've got no head. So there's loads.
You made him fix his neck.
I know he lifted up there, didn't he? He just went that bit straighter. Man is changing, you know. The skeletal shape is changing.
So yeah, you see a lot of people coming in now and
yeah,
injuries
which
because
leads
of
to
that.
the shoulder. This is why we've got more shoulder things going on, because that kyphosis at the top and the lordosis with the neck.
So when you're scrolling on social media, how do you prevent yourself from ruining your shoulders and neck posture?
I'm the same as anyone, and my head is down, and then I realise that my neck is hurting a little bit, or I might be going a bit tight, or I might even get some burning in the back of my shoulders as well. So I just lift it up. I lift it up. I don't put my phone down. I lift it up.
And your arm starts burning.
I'm as guilty as the next person for the phone and the desk.
Yeah.
And the desk stuff. But I'm very fortunate. I have a rising desk, and I also have my treatment table, so I raise everything up. So it's a little bit better for my posture.
Because it's important also for you as an osteopath, right? As someone who engages in manual therapy, to also preserve your own body. Because if you have problems, you won't be able to maybe treat your clients.
Yeah, it's funny you should say that. People don't think about that, but that's really good of you to think like that. Yeah, I think that's another reason that keeps me fit, is because if I'm not fit, I'm not able to work. If I'm not fit, if I'm injured, I can't work. I'm self-employed. So yeah, I have to protect myself. Fortunate that I've got the rising table, and looking after the position that you're in is how we're taught right from scratch anyway. But if I didn't do any exercise or any activity, I'd become weak, and then I'd be having a problem myself.
How do you stay fit?
I do Pilates, I walk, I do short little HIIT classes, I paddleboard when it's nice. I don't know, I like to just move, so
yeah.
I dance.
You still dance?
Yeah, I've just gone back to salsa.
Wow.
Yeah.
Back to salsa?
Yeah, because I've not done that for a long time. Yeah.
Wow, that sounds fun. I hope one day I'll have the confidence to go to a salsa class. Class or club?
It's a class. I'm only at the beginning. Yeah, I've not plucked up the courage to go to a club yet.
That's awesome. But Pilates you take pretty seriously.
Yeah, I've done 2.5 years of training Pilates. I just didn't take my exam, which is very silly of me. But that's something that I'm going to complete. I think Joseph Pilates, the way it fits very well with osteopathy, about making things move and things flowing, and strengthening as well as lengthening, but also strengthening. So stretching and stabilizing.
Because what you just said with the neck, the phones, the tech people, the rat race, the computers, working from home, all those things, I guess it should be more prominent now, because like as a young kid I was not on my phone all the time. Now I am, but now young kids are on their phone. They're growing up with bent necks non-stop or rounded shoulders.
Honestly.
So we're forcing ourselves to collapse. You sit on a chair or a couch, you're always collapsing. On your phone you're collapsing. Even when you wait in line or a queue, we're collapsing on our phones.
Yeah. I'm seeing younger, like 13 and 14-year-olds with postures that it's sad. It's sad. Some people when they're gaming, they sit leaning right far forwards, and then they think that they can go and play rugby, and they wonder why their mum has to bring them to have their back manipulated, because they don't realise the positions that they're getting themselves into. But the younger kids sitting at school, but then sitting when they're not at school, and the head down, it's like they've got a 30-year-old or a 40-year-old shape of their spine. Yeah,
it's kind of scary.
It's
what do you advise like teenagers, kids who are developing already like rounded shoulders or bent neck? Because what I would think is, and what I try and do is, you want to because very difficult to now stop being on my phone. So also, yes, I can, like you caught me yesterday with my neck looking straight down, my neck almost parallel to the ground. But you try and do things to negate that movement.
Yeah.
But how do you get into a teenager's brain and get them to understand? Because I don't think I would have listened to anyone if I was a teenager and they told me to get off my phone.
No.
I'll be like, I'm on YouTube, leave me alone.
Leave me alone, get away. Yeah, I did actually say to somebody this week, this is the deal. You know, you're not going to have to keep coming back here if, when your mum says you need to move, that's the deal, okay? You know, if you want to come back and have some treatment, the deal is that you let your mum, without any back chat, say to you, listen, it's time to move. Even if you get up and move around, just don't stay in that position for too long. Bribery. Bribery works for teenagers.
Yeah. I think bribery sounds a lot more logical than listening to your mum as a teenager.
Yeah. It is a difficult one, but especially for those teenagers that haven't got a sport or an activity that they enjoy, scaring them with images, scaring them with what could go wrong, a little bit of exaggeration of what could go wrong later on, but you've got to be really careful with that.
So maybe the profession of a osteopath or a chiropractor or any manual therapist out there will only be more desired in the future because we're raising generations. I'll classify my next generation in there as well, you know, being on a computer all day. It's so hard, even when you're focused on sitting upright, you know, using your sit bones and all that stuff. After 40 minutes, and I'm exaggerating now, I wish it was 40 minutes, but after however many minutes you're able to last, you collapse.
Yeah.
And you try again, you collapse. It's so difficult. So, you know, I think we have generations of shoulder and back pains.
More so, absolutely.
Ahead of us. And it's a weird one, right? Because a couple generations ago, there were probably, I don't know if more, but a lot, maybe just as much injuries because of manual labor that people were doing. And now we shifted into the opposite of manual labor, where the computer does all the work for us, but we destroy our bodies because it's difficult.
Yeah, I was going to say way back, people would be walking across the fields to go and get their groceries or whatever, and they'd be really, really active. And then it was too much hard labour, like you say, and the stress and the strain on the body was one thing, and now we've got the inactivity. But it depends which way. I mean, some people say, oh, all this exercise is like a new religion. It is for some people. Exercise and food and nutrition, it's all over social media. And people say, oh, it's a new cult, it's a new religion. It's a good one. But there are many people who, you know, still shoveling the wrong things down their necks and not being active. How could the body possibly support you and keep you going if you don't look after it and fuel it well?
So pain's not going away?
Pain's not going away, no. It shouldn't go away because it's a warning, isn't it? Pain is a warning.
Keeps us on track.
Yeah. Stiffness is the first one, but some people don't notice the stiffness. And I say to my patients all the time, if you can get used to noticing first that it's not hurting, but I just can't quite turn my head like I used to. If you notice that first, that's when you come in. You don't wait for pain.
So I'll take it even a step further, and also based on your advice, people have to move. Because if you don't move, you will never notice those stiff days, off days, when things aren't working the way they're supposed to, because if you're just sitting on a couch all the time.
Yeah, if you never move or you're always inactive, then you're never going to challenge the body to do something else. So you might not notice the pain of when you do move. But say for an example, like somebody who says, I've decided I'm going to the gym, never been before. When they go to the gym, they injure themselves because they've never done it. And they say, what's all that gym bit about? I'm not doing that again. It hurts. I'm injured. Yeah, but that's just because you've not conditioned your body to, train for it, prepare for it, warm it up, get used to moving it. So yeah, it's a fine line. But if somebody was just a couch potato, and those fluids weren't flowing around the body well, everything is stagnant and congested, it's just going to lead to a backup, and those tissues and those organs are going to have dis-ease, in my opinion.
What do you wish you have known maybe 20 years ago that you've learned over time that helped you or helps you now? If an osteopath who's just finishing university came to you now for some advice.
About osteopathy or about
osteopathy, about working with patients, just in general, things that anything that really put an imprint on your professional development, that took you time to discover, time to learn.
Collaborating with other professionals, asking for help or asking for other people's opinions. I think I was very fortunate, but I think there's a lot of osteopaths who come out of university, or a lot of manual therapy workers who come out from their qualification and they work in isolation, and they have the knowledge that they have. Sometimes they have the knowledge but don't know how to apply it, or they haven't got anybody to bounce ideas off or question maybe if something is not going in the right way. So collaborating, reaching out to other people and not being fearful. Hands up here. I used to keep myself hidden away quite a bit. Not being fearful of collaborating and asking questions and mixing and learning all the time. I think you've got to it's consistency with learning. It's just because you don't know something or you've forgotten something, it's not you can't know everything all of the time. When you're in clinic, you may see a lot of this and you do a lot of that, and then you forget some of the other stuff. It's okay. It's okay to then go back to your studies about that other area, or go and ask another colleague or another manual worker or another professional for some information about that other thing that you haven't maybe paid attention to for a little while. But reaching out, community, and also consistency, learning, forever learning.
Because we'll never be able to know everything about the human body.
No.
What do you think of ballet now?
Oh, I think ballet is beautiful, but I think it's probably had an influence on the perfectionism side of me, which I don't think it was a good thing. It's harsh discipline, like gymnastics. It's a harsh discipline. It's beautiful to watch, but it's very, very blinkered, and ballet builds people up to an image of perfection. Nothing is perfect. Nobody is perfect, and what happens when that goes away can be quite sad. Yeah.
Carolyn Greenhalgh.
Greenhalgh, yeah.
Thank you very much for being here. Can't wait till the next time, and the course will be available in the next couple months on the website. Very exciting, so keep an eye out for our social media. Where can people find you and your content?
On my website, which is carolyngreenhalgh.co.uk, or on Instagram, I am Carolyn G Osteopathy, or on Facebook, yeah.
Do you want to spell Greenhalgh for us, and then we'll wrap it up? It's
GREENHALGH, so it's Carolyn-G Osteopathy. But thank you for having me. I've really enjoyed chatting with you. It's been great. The last few days has been amazing. Thank you.
It's been a pleasure. Thank you very much.
Thank you.